one of my other questions was going to be like, oh, about how long does it take to kind of, really see the results? And you said if you stick with it for 6 months, there's a good chance you're going to see really positive results, is kind of what I'm gathering from what you said there.
After about 6 months, I wouldn't say that's, but you're fully reversed in 6 months.
Okay.
But in six months, you can really clean up the system in the sense of restoring a significant amount of insulin sensitivity. So really curing a lot of the insulin resistance, coming off the medications, reducing a lot of the inflammation. Like within 6 months, you can almost feel like an entirely different person. It's wild. I always joke that I'm Megan. I'm in a boardroom or, on a night out with friends. I'm very much Megan. I have one kind of personality. I'm just a happy-go-lucky Canadian lady. But I've had like 10 different metabolic personalities, and each one of them has different nutrient requirements, needs different fasting protocols, needs different types of physical activity. But I've just healed so much. So, you can become an entirely different metabolic person in 6 months, but then there's still healing that has to happen after that. So on paper, you can get awesome labs. You can feel like a new person. You can be off a bunch of medications, but then usually at that 6 month mark, we scale things down a bit, but we still say on top of it, it's a more mild therapeutic approach that we follow people with for about another 6 to 12 months. And then usually like that 12 to 18 month mark, people are really seeing kind of wild transformations.
Yeah, when you zoom out and kind of look at the big picture, because of course people always want these like quick results with things, especially in this modern age. But when you zoom out and think of it, yeah, like decades of problems that in a year or two have been pretty much fixed, and maybe not 100%, and maybe it'll never be 100%. It reminds me of, I was reading this book about low back pain or rehabbing low back problems. And the author kind of pointed out, like, yeah, you'll probably get to this point where you're pretty normal, you can function pretty normally, but you'll probably still need to do a little extra maintenance than someone who never had those problems to begin with. And I'm sure it's kind of true for diabetes too. So you can get to where you're pretty normal, but you probably need to do a little more maintenance than someone who's never been there before.